All right. As mentioned, we continue to have some technical difficulties here. So we were going to have Ontario's top doctor, Dr. Kieran Moore, joining us via Zoom. We're going to be doing this by phone. So Dr. Moore, can you hear me?
Oh, I can, Mel. I'm sorry about the technical issues.
Oh, no, we apologize as well, but I'm glad we could get you on the line because there's a lot of information that we want to get to our viewers with regards to COVID-19. You spoke to our friend Richard Southern yesterday, and some interesting news when it comes to potentially rolling out that second booster for the general adult population. Can you give us an update again on where all of that stands?
Well, Mel, yes, we are in the seventh wave, and we're seeing a rise of a virus strain called BA5. And I know the word wave is scary to some, but we do anticipate that this wave is going to be less intense. We're monitoring it very closely and how it will affect Ontarians. Our key messaging on immunization is basically staying up to date, and I'm a little concerned that 5 million Ontarians still haven't come forward for their first booster, 1 million of whom are 50 years in age and older, and we know COVID has more severe outcomes if you're older and not up to date. So please, our first message is if you haven't had your first booster and you're at risk for severe outcomes, please come forward. For our second booster, which has been 60 years of age and older and other subgroups, 1.6 million Ontarians still haven't had that second booster. So we're asking them to come forward to stay protected. We know that the protection from the vaccine does fade over time. So by 5 or 6 months from your last dose, your protection has decreased from around 90% after a booster down to 70, 60, or lower, depending on your immune system. So first, please come forward, stay up to date with your first or second booster, and we're reviewing opening up eligibility depending on our ability to immunize individuals in the coming weeks. Right now, I'm so happy to say that we have had increased uptake. Ever since we've been messaging this in the last week, we've gone from around 10,000 a day to 14 to 15,000, and we'll wait for the numbers today. So Ontarians are listening, and really appreciate them staying up to date with their vaccine.
Yeah, that is definitely encouraging. Dr. Moore, I got to ask you this question, though, because there is the criticism that maybe this messaging should have come out sooner for people, because you did see a drop in uptake when it came to that first booster. A lot of people just put it aside and, said, to be quite frank, COVID is over. We are fine. We're opening up the province. The masking is gone. Do we think in hindsight that perhaps this messaging should have been pushed ahead in the timeline?
Oh, I absolutely have been trying to have this message of stay up to date. We've been saying that message since April, and we know that there is fatigue in our messaging. People are tired of the pandemic, period. And I'm sorry that we're experiencing this seventh wave of Omicron, but our messaging has been consistent. Clearly, people are listening more now, which is great, and we'll continue it through our sister health units. They're all resonating the same message at a local level, but we've been consistent in the messaging, as well as please know if you're eligible for Paxlovid, which is that outpatient therapy. Ontario has been a leader in prescribing of this through family practice in our local pharmacies, and over 22,000 Ontarians have taken advantage of Paxlovid. So know if you're eligible, and if you're eligible basically if you've got any underlying significant illness, or you haven't been up to date, or you're over 70.
Dr. Moore, I want to go backward for a second. You talked about the ability to roll this out. When you talk about ability, is it to have the personnel to be able to provide these booster shots? Is it the supply issue? What is it that we're waiting on?
Well, happily, it's not a supply issue, but you're hearing about health human resources across Ontario for the health system, and we're trying to ensure that we can vaccinate at any given day up to 100,000 Ontarians if there's a demand, and that's through our great partnership with our local public health agencies, our pharmacies, and some of our primary care providers. So we're trying to maintain that capacity, and the access is there, and we certainly hope Ontarians continue to hear this message.
Okay, so we're awaiting this potential update next week. I want to ask you quickly about the pediatric vaccine. We're waiting on Health Canada for that approval. As soon as that comes down, are we ready here in the province of Ontario to roll that out?
Yes, we've been working diligently with all of our partners as usual, and in particular our primary care partners. Through our surveys, we anticipate that families would most want to have their child vaccinated in the family practice setting. So we've been working diligently with the Ontario College of Family Physicians to have those protocols in play. We're absolutely waiting for the Health Canada approval and the National Advisory Committee approval, and can roll that out when available. It may be later in August. August that we have that available for 6 months to 4 years of age.
Okay, Dr. Kieran Moore, appreciate you taking the time to join us. Can I just show on our camera here how we were doing this? Because of the issues that we're dealing with, this is how we made that interview happen. A microphone and a phone. Look at that. Look at technology. Dr. Kieran Moore, appreciate your time. Thank you so much.